Okay, so knock knock.
Come in.
I'm gonna wash my hands. Hi, Mr. Dubois. My name is Karina. I'll be your nurse today. I'm gonna close the door for privacy and wash my hands again. Can you verify your name and date of birth for me?
Boy Dubois, 430.
Okay, and are you allergic to anything?
Shellfish.
Okay, you have an allergy ban, and your MR number is 7727893. Mr. Dubois, do you know where you are right now?
Hospital.
And do you know what date it is today?
1024, I believe.
Okay, and do you know why you're here?
Yes.
Okay, why are you here?
My hip.
Okay. Okay, alright. I am here to do a head to toe. Is that okay?
Yes, that's fine.
Okay, alright. So I'm gonna get a quick set of vitals on you, and your blood pressure is
130/72.
your temperature,
99.4.
your O2,
97.
yes, 97%, your heart rate,
75.
and your respirations,
22.
yes. Okay, alright. Mr. Dubois, are you in any pain right now?
Yes.
Okay, on a scale of 1 to 10, how would you rate your pain?
About a 3.
Okay, and where's your pain located?
In my right hip.
Okay, and does your pain radiate anywhere?
No, not at all.
Okay, and what's the quality of your pain? Is it sharp, achy?
Yes, very.
Very sharp?
Yep.
Okay, and when did your pain start? A couple days after surgery? Or before surgery? Okay. Alright. Okay, so I did that. So now, okay, so now I'm going to inspect your eyes, and your pupil size is a 4. I'm gonna have you focus on an object behind me, and I'm gonna check for constriction. I'm just gonna shine this light in your eye. Okay. Okay, great. And I'm gonna have you follow my finger. Alright, and perla is present. Pupils are equal, round, and reactive to light and accommodation. Can you say "ah" for me? And your mucous membranes are pink, moist, and intact. There's no sores or any lesions. Okay, alright. So I'm going to unbutton your gown so I can listen to your heart and to your lungs. I'm going to check for skin turgor, and it's non-tinting. Your chest is symmetrical, colors appropriate for ethnicity, and there's no skin breakdown. I'm going to listen to 8 positions in the front and 10 positions in the back. Okay, your lung sounds are clear. Mr. Dubois, have you had a cough recently?
Yes.
Is it a productive or non-productive cough?
Productive.
And what color is it?
White.
And is it thick or thin?
Thin.
And if I give you a cup, about how much?
5 milliliters.
Okay, and alright, so now I'm going to listen to your heart sounds. I'm going to start on the right, second intercostal space, the aortic. S1, S2 heard. Then the second intercostal space on the left, the pulmonic. S1, S2 heard. The third intercostal space on the left, Erb's point. S1, S2 heard. Fourth intercostal space on the left, tricuspid. S1, S2 heard. And the fifth intercostal space, the mitral midclavicular line. S1, S2 heard, and I'm going to listen with the bell for a couple seconds. And there's no murmurs or any extra heart sounds noted. I'm going to listen here for 1 full minute. Okay. And your apical pulse was 80. Okay. So now I'm going to check your brachial pulses. I'm going to cover you back up and I'm going to check your brachial pulses. And they're 2+ bilaterally. I'm going to check your radial pulses. And it's 2+ bilaterally. I'm going to check capillary refill. And it's less than 3 seconds. I'm going to have you push up, then push down. I'm going to have you grip my finger. Okay, alright. And upper extremities +5. I'm going to inspect your IV site, and it's clean, dry, and intact. There's no redness or any swelling or signs of infiltration. It's dated for today, so I'm going to come back and flush it for you whenever I come to administer your medication. Is that okay?
Yes.
Okay, and also increasing your fluid intake will help thin out that mucus. It will also help increase the fluid intake. And cough and deep breathing exercises will help get that mucus out. Now I'm going to inspect your abdomen, and I'm just going to lift it up, and it's flat. There's no masses and the color is appropriate for ethnicity. I'm going to auscultate. I'm going to start in the right lower quadrant, in the right upper quadrant, the left upper quadrant, then the left lower quadrant, and bowel sounds are active. I'm going to palpate. Let me know if you feel any pain or tenderness, okay?
Okay.
You feel any pain or tenderness down here?
No.
Okay, what about up here?
No.
Over here?
Nope.
And down here?
No.
Okay, alright, good. So there's no pain or tenderness upon palpation. I'm going to check the respiratory rate and rhythm. And it's regular, it's shallow, and unlabored. Mr. Dubois, when was the last time you had a bowel movement?
Before surgery.
Okay, and what color was it?
Brown.
And did it have a smell to it?
No, it was pretty normal.
And what was the consistency of that?
Formed.
Okay, and was it small, medium, or large?
Medium.
Medium. Okay, and what did you have for breakfast? Nothing. Okay. And when was the last time you urinated?
Way before surgery.
Okay. And what color was it?
Yellow.
And did it have a smell to it?
No.
And was it clear or cloudy?
Clear.
And what was the amount on that? You don't remember. Okay. And was it painful?
No.
What about, did you have a sense of urgency?
No.
And did you have any changes in frequency?
Yeah, it's decreased.
Okay. Okay, right. Alright, so now I'm going to move down to your genitals. And I'm just going to inspect. I'm going to wash my hands and put clean gloves on. And your genitals, there's no swelling, there's no discharge or any redness or sores. There's no abnormality, so I'm going to cover you back up. I'm going to take my gloves off and wash my hands again. I'm going to put clean gloves on again. Mr. Dubois, I also want to encourage you to turn every 2 hours. It'll help prevent skin breakdown. Can you give me a little bit of feedback on that?
Yeah, turn every 2 hours, so to prevent the skin breaking down more.
Yes, exactly. And don't forget the cough and deep breathing exercises will help get that mucus out. Okay, so I'm going to inspect the lower extremities, and there's no skin breakdown. Color is appropriate for ethnicity. Skin is warm to touch. I'm going to check for edema. and there's no edema present. I'm going to move down to the toes. I'm going to check capillary refill, and it's less than 3 seconds. I'm going to check the dorsalis pulse, and it's less than 3 seconds. I'm going to check your posterior tibial pulse, and that's it's 2+ bilaterally. And I'm going to have you push down on my hand, and have you push up, okay? And the strength on the right leg is +4, and on the left leg is +5. So I'm going to take my gloves off. I'm going to wash my hands, and I'm going to do a little bit of teaching. So, Mr. Dubois, this is an essential spirometer. This will help open up your lungs. It'll keep your lungs free of fluid. It'll help prevent lung infections like pneumonia. It'll help get rid of the mucus that's built up, and it'll also improve your lung function. And the way you want to use it, you want to make sure that you sit upright, or you sit up as far as you can. You're going to hold this upright, and you're going to cover the mouthpiece tightly with your lips. You're going to inhale. You're going to hold it for about 5 seconds. Then you're going to exhale. And you're going to want to do that or repeat it at least 10 times an hour or every commercial break. Here, I'm going to have you try it. So here, you do it. Okay, and you got 750 ml, so that's not too bad. Okay, alright, so what are the benefits of using this essential spirometer? It'll help with my lung function. It'll help get rid of the mucus that I have build up, and it'll help prevent lung infections. Yes. Okay. Okay, right, so I'm gonna put this back. And also, I want to encourage you to ambulate, because ambulating will help decrease blood clots. It'll also help with constipation. You may not be constipated right now, but you take morphine, and morphine is for pain, or it's used for severe pain, and one of the side effects is constipation. So you want to make sure that you increase your fluid intake and you ambulate as much as possible. And is there anything else I can do for you?
No, thank you.
Okay, right. So I'm going to make sure that the bed is in the lowest position, the rails are up, your call light is within reach. I am going to call your doctor and report the findings, so I'm going to close it or open the door and wash my hands. You can turn it off.